My name is Jessica, and I am a microbiologist in the lab at EIRMC. The lab is kind of a mystery, I think, for most people because we send specimens there, we don't really know what happens, some sort of magic happens, then results appear. We really are kind of Sherlock Holmes, solving mysteries down in the lab, figuring out what is going on with the patient so that we can help them feel better. Early one Sunday morning, we had an infant come into the ER, just a 2-month-old. And it was clear that this patient was really sick and that they weren't really sure what was causing the illness. So in microbiology, I would get the urine, right? You need a certain amount to be able to run testing, and we had enough to do a culture, but we didn't have enough to do any of the preliminary testing to find out, to rule out quickly, is this a urinary tract infection or not? Is this a UTI? Is it not a UTI? So I knew that I had enough to do culture, but that takes 24 hours, so it takes a little bit of time. When your kid is sick, that is the worst, right? You feel so helpless, and you just don't know what to do. There's a test that we don't particularly do normally on urine because it's not really beneficial, but I knew that in this case it would be really helpful, and so I had when I say I didn't have a lot, I'm telling you I had drops. So I put a tiny little drop on a microscope slide and looked at it under the microscope, and it was just swarming with bacteria, and it was very clear that this patient had an infection, and that was the cause of the sickness for the baby. Having an answer is huge. Having an answer and knowing what to do with that answer is a big thing.